Yes, you're using your sunscreen regularly, you're using an expensive cream to treat your melasma, but it is not budging. Why does that happen? Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist at Naya Dermatology and Aesthetics. Today, let me explain you about melasma, a chronic pigmentary concerns that affect a large population. Melasma is a chronic pigmentary concern, and for us dermatologists, it is one of the most difficult pigmentary concerns to treat. Why? Because melasma is not because of one single factor that we can address. It is a multi-factorial condition, and there is inflammation and also immune process in this whole pigmentation. Genetics, sun exposure, autoimmune process, hormonal imbalance, all of these factors play a key role in the presentation of melasma, and since there are a lot of factors involved, the treatment becomes even more difficult. Does melasma affect your health? Not really. It is a simple pigmentary concern, but emotionally very distressing because it is seen as these dark patches right on the center of your face involving your forehead, cheeks, upper lip, or sometimes even the chin area. How do we treat this condition is something that we dermatologists are always struggling with. There are multiple factors and multiple issues that we need to address when you're looking at the treatment of melasma. One of the most important factors we need to understand when it comes to the treatment of melasma is that melasma can be either superficial or deep. But most of the melasmas which have crossed 1 to 2 years are a mixed variant where there is a superficial or epidermal component and a deeper or a dermal component. When it becomes dermal, to clear out this dermal pigment, it is very difficult. It does not budge to any skin lightening creams or even a chemical peel, and only a Q-switch Nd:YAG laser can address this pigmentation. So this is the reason why even if you're using a skin lightening cream or a good sunscreen, your melasma might not improve because the pigment is deeper and these ingredients cannot improve your melasma. Okay, let's say you opted for a Q-switch Nd:YAG laser for your melasma. Does that completely treat your melasma? Is it the guarantee that your melasma might never come back? No, it's not that simple. Like I said, melasma is a very difficult condition to treat and every person responds differently to the treatment. I've seen people having 80% result with the Q-switch laser, and I've also seen people having 0 result with the procedure. This varies between persons and we cannot predict the outcome of the treatment. And only when you opt for different modalities and where we combine all the factors and all the essential treatments here required, you will see certain improvement. But again, like I said, this varies from person to person. Another mistake is that a lot of people who has responded beautifully to a Q-switch laser think that the melasma is not going to come back. Please understand that melasma is a chronic condition and it can come back later at any time if you're not maintaining it well with your creams and sunscreens. Also, if you can do a Q-switch laser every few months for maintenance, it will help in keeping that melasma under control. So this video is not about what are the reasons for melasma, what is the underlying cause for melasma, or how do we treat it. I'm making this video for you to understand that it is a chronic condition, there is no permanent solution. Whatever treatment options you opt for, there is only so much we can do and we cannot completely treat it. And the most important factor here is the results vary between person to person and it is not the same for everyone. And if you're opting for an in-clinic procedure like a chemical peel or a Q-switch laser, please do have realistic expectations. Go in for the procedure only if you're okay with that 30% result and not expect a 100% result. And if you get that 80 to 100% result, it is great, but doesn't mean it happens to everyone. If you want to know more about what are the different treatment options we have for treating melasma, please comment below. And if you found this video useful or informative, please subscribe to my channel for more such videos.